Welcome to Health and Wellness. I'm Will, nurse practitioner, and today we're going to be overviewing how to present a patient to a provider over the phone. When I was a new RN, this is what would terrify me when I would have to call the doctor. I would get my notes in order, my voice would shake, and I would still somehow get yelled at for not giving the information that they wanted. Not giving the correct SBAR in the format that they're used to can cause tension and miscommunication. Now, in general, this does follow an SBAR format, but it's more specific than that. Now, this is useful for both RNs and nurse practitioners, so this applies to everyone. Step 1 is the introduction. You need to introduce yourself and your patient.
Hi, my name is Michelle and I'm calling from 1G. I'm the nurse taking care of Anita Lopez in 230 bed 2. Are you familiar with her?
You need to introduce who you are, where you're calling from, and who you're calling about. I can't tell you how many times the nurse has called me and launched into a full explanation of what's going on without me knowing who the patient is. They'll finish their long explanation and then I have to say, who's the patient? The next critical step to ask is if they're familiar with the patient. If I just admitted the patient, I don't need a full rundown of why they came in and what's going on. Let's say me as the nurse practitioner is calling the cardiologist that the patient sees outpatient, and I speak to that cardiologist. He's likely very familiar with the patient already, so I don't need to launch into the patient's medical history. However, many times providers won't be knowledgeable with the patient because you never know who's on call in their physician group. Another important step, depending on your facility, is to list the attending physician. Some services may only cover certain physicians. Step number 2 is a brief history of the patient's background.
She's a 78-year-old female who came in on 11/28 for a COPD exacerbation. She has a past medical history of COPD, smoking, hypertension, hyperlipidemia, and AFib, which she's on Coumadin for.
In the inpatient setting, no matter why you're calling, if I'm not familiar with the patient, I want to know why the patient was admitted to the hospital. This will give me some context of what I'm dealing with. If a patient came in for a COPD exacerbation and has a headache from coughing, that is much less worrisome than a patient who came in for a TIA or a mechanical fall. Additionally, a brief overview should be given of their past medical history. Make sure you hit the big ones. List their major medical history, and if it's a very long list, list the important ones to why you're calling. Step number 3 is the why. Why are you calling the provider? This is classically the S in SBAR, or the situation.
The patient is complaining of increased shortness of breath.
I don't need to know what happened every single day, but give me a quick rundown to help me understand the current situation. Step 4 is the situation background, so the background of why you're calling.
They are ordered 2 NFs every 6 hours, the last one 2.5 hours ago, and they have nothing ordered PRN.
So by this point, you've already given the important information: who you are, who your patient is, their medical history, why they're admitted to the hospital, and why you're calling. And now you can give a little bit more background and context to why you're calling. You need to be able to do some investigation on your own before you call the provider. In this instance, the patient is short of breath and there for a COPD exacerbation. Do they have breathing treatments ordered, and how often? Step number 5 is assessment.
The patient's respirations are 24 per minute, and SpO2 is 90% on 2 liters nasal cannula. Their breathing is non-labored, lung sound shows expiratory wheezes throughout.
As the nurse, you are responsible for assessing the patient whenever there is a change of status. Give me a set of relevant, updated vital signs and a quick assessment of the systems involved. If they're short of breath, give me their lung sounds. And when talking about vital signs, please make sure the vital signs are up to date. The patient's vital signs can change rapidly, and 3 hours ago is no longer relevant. That's just good practice. Step number 6 is recommendations.
Can you please add breathing treatments PRN for in-between scheduled duo-nubs?
Nurses are the eyes, ears, and hands of healthcare. They are on the front lines, well educated, and often have great recommendations for their patients. Maybe you know just what your patient needs to feel better. It's important to communicate that to the provider. Another important recommendation is asking for the provider to evaluate the patient if it's indicated. Asking the provider to personally come and evaluate the patient, if it's feasible and indicated, is a great way to make sure your patient is in good hands. So yes, it's SBAR, but with some important, critical steps beforehand. But what if you're a provider and need to know how to call another provider or call a specialist? It follows the same general pattern. The more you do it, the more you're gonna get used to dropping the unimportant parts and giving the provider exactly what they're looking for. There really is no significant difference between a good nurse to provider report and a provider to provider report. As long as the relevant information is conveyed in a concise and organized manner, you're going to impress your colleagues, both physicians and nurses, and nurse practitioners. Not only that, but you're going to ensure great communication, making sure that your patient gets the best care possible. And that's how you give a good provider report. If you like this video, make sure to subscribe and check out my blog below. Thanks for watching.